Hello everyone, welcome back to my channel. So in this video we will continue solving questions of chapter 5 gingivitis. So let's begin. Question 21. Bleeding on probing will tell us the option A, gingival health of child, option B, status of gingival health on the day of examination, option C, 7 days after prophylaxis, option D, 14 days after prophylaxis. So the answer is option B, status of gingival health on the day of examination. Bleeding on probing will tell us the status of gingival health on the day of examination. Now question 22. Pigmentation of chemicals in mucosa is due to option A, increased permeability of blood vessels, option B, local deposition of chemicals in mucosa, option C, subepithelial precipitation in connective tissue at the site due to increased capillary permeability, option D, none of the above. So the answer is option B, local deposition of chemicals in mucosa. Now question 23. Features of gingivitis. Option A, inflamed tissue, option B, bleeding on probing, option C, increased gingival fluid, option D, all. So the answer is all of the above. Question 24. Gingival recession is most common due to toothbrush trauma, option B, TFO, trauma from occlusion, option C, defective contacts, option D, anug. So the answer is option A, toothbrush trauma. Gingival recession is most common due to toothbrush trauma. Etiological factors of gingival recession: faulty toothbrushing technique, high frenal attachment, gingival inflammation, tooth malposition, and gingival ablation. Now question 25. Plasma cells are most commonly seen in one of the stages of gingivitis. So we have studied about it. The answer is option C, established lesion. In the initial lesion, it occurs in 2 to 4 days and the predominant cells are PMNs. In the early lesion, which is seen at 4 to 7 days, the predominant cell is lymphocyte. Established lesion 14 to 21 days and the predominant cell is plasma cell. Advanced lesion greater than 21 days and the predominant cell is plasma cells and neutrophils. So the answer is established lesion. Question 26. In gingivitis, the immunoglobulins are consistent with the increase in number of option A, fibroblast, option B, neutrophils, option C, lymphocytes, option D, plasma cells. So the answer is plasma cells. The established lesion of gingivitis is characterized by predominance of plasma cells and B lymphocytes. The B cells found in established lesion are predominantly IgG1 and IgG3 subclasses. Okay, now question 27. The following condition do not create gingival defect necessitating gingivoplasty except option A, anug, option B, desquamative gingivitis, option C, erosion lichen planus, option D, acute herpetic gingivostomatitis. So the answer is option A, anug. Now question 28. One common radiographic finding in clinical gingivitis is option A, vertical bone loss, option B, normal bone pattern, option C, horizontal bone loss, option D, increase in bone density. So the answer is option B, normal bone pattern. The common radiographic finding in clinical gingivitis is normal bone pattern. Okay. Now question 29. The most important cell which contributes to the severity of periodontal disease is option A, lymphocyte, option B, neutrophil, option C, mast cell, option D, plasma cells. So the answer is option D, plasma cell. Now question 30. The change in color, shape and texture of gingiva are seen in option A, stage 1 gingivitis, option B, stage 2 gingivitis, option C, stage 3 gingivitis, or option D, stage 4 gingivitis. So the answer is option C, stage 3 gingivitis. In chronic stage 3 gingivitis, the blood vessels become engorged and congested, venous return is impaired and blood flow becomes sluggish. This results in reddened gingiva with superimposed bluish hue. Also, the breakdown of hemoglobin into its component pigments can further deepen the color. Now question 31. Collagen fibrils have a transverse striation with a characteristic periodicity of. So the answer is option B, 64 nanometer. Collagen fibrils have a transverse striation with a characteristic periodicity of 64 nanometer. Question 32. Early and established stage of gingivitis is differentiated by increase in the number of. So the answer is option A, plasma cells. Okay, early and established gingivitis is differentiated by increase in the number of plasma cells. Question 33. Which stage of gingivitis is also called subclinical gingivitis? So the answer is option A, initial stage. It is also known as subclinical gingivitis. Question 34. Pregnancy gingivitis is caused by. So the answer is option A, Bacteroides melanogenicus. Pregnancy gingivitis is caused by Bacteroides melanogenicus. Prevotella intermedia species are increased during pregnancy gingivitis, whereas Capnocytophaga species are increased in puberty gingivitis. Prevotella is a new genus that includes Bacteroides intermedia, Bacteroides melanogenicus and related species. Okay. Now question 35. When the dental plaque is allowed to accumulate in the absence of any plaque control procedures, it results in the gingivitis within. So the answer is option B, 7 to 21 days. Chronic gingivitis occurs 2 to 3 weeks after the beginning of plaque accumulation. Okay, now 36. Atypical gingivitis is. Option is other name of plasma cell gingivitis. Option B, gingivitis seen in HIV patients. Option C, gingivitis seen in leukemia patients. Option D, gingivitis seen in aggressive periodontitis. So the answer is option A, other name of plasma cell gingivitis. Other name of plasma cell gingivitis are atypical gingivitis or plasma cell gingivostomatitis or plasmacytosis of gingiva. Now question 37. Not responsible for chronic gingival inflammation. Option A, neutrophil. Option B, macrophages. Option C, T lymphocytes. Option D, plasma cells. So the answer is neutrophil. Neutrophil are characteristically seen in acute gingivitis. Okay. Question 38. Localized diffuse gingivitis extends from. So option A, the interdental papilla to attached gingiva in a limited area. Option B, the margin to attached gingiva in a limited area. Option C, the interdental papilla to mucobuccal fold in a limited area. Or option D, the margins to the mucobuccal fold in a limited area. So the answer is option D, the margins to the mucobuccal fold in a limited area. Localized diffuse gingivitis extends from the margins to the mucobuccal fold in a limited area. Localized marginal gingivitis is confined to one or more areas of marginal gingiva. Localized papillary gingivitis is confined to one or more interdental spaces in a limited area. Generalized marginal gingivitis involve the gingival margins in relation to all the teeth. The interdental papilla are usually affected. Generalized diffuse gingivitis involve the entire gingiva. The alveolar mucosa and attached gingiva are affected, so the mucogingival junction is sometimes obliterated. So we have done all the questions from this chapter. If you like this video, please do like and subscribe to this channel. Thank you so much.